I'm really pleased today to be able to announce the release of our annual report on the state of the Department of Medicine. It really is an opportunity every year with this report to highlight the people, the projects, the work that we all do together, whether it's caring for patients, doing innovation and research, or educating and training the next generation. It really is a chance to really share with people what we've been about in the department. This year has been especially difficult. We all know that. There's been a global COVID-19 pandemic. We've seen the impact of social justice and the calling out of systemic racism as a real threat to not only the public health, but the real health of individuals and of communities. We've seen environmental disasters, including locally, with the effects of wildfires. But throughout all of this, it's been really incredible to watch what this department has done. We've seen resilience, we've seen compassion, and we've seen collaboration. A lot of the work of the department has been directed at COVID-19, not surprisingly. We've seen our data scientists roll up their sleeves, even in some case, change the focus of their research to do simulation modeling around the disease. We've seen our primary care physicians and others really interested in understanding the long-term implication of COVID and the establishment of things like the Crown Clinic. We have a group of investigators, not just across the department, but across the university, who are trying to understand long-haul COVID. Our hospital medicine group and many of our internal medicine subspecialists have been right at the forefront of caring for our hospitalized patients. We've pulled in our community. There's been projects involving high school students that have worked with data scientists to understand how do schools reopen? How might we understand increases in COVID-19 patients? There's been people developing new assays for COVID antibodies, and we've seen people raise funds or grocery shop for those who are in need and need help. But I would say that COVID has also shown us that we can expand what we usually do into new directions. For example, in the clinical trials realm, hospital medicine has done its first set of clinical trials, playing leadership roles in both NIH and industry-sponsored trials. And interestingly, we've seen our first clinical trials performed at Valley Care in the East Bay. We've even had to launch a tent in order to enroll patients in clinical trials to collect biospecimens, truly showing how resilient and how innovative people in this department are. In our innovation and global health program, we've seen the work done by Women Lift Health. Our Department of Medicine diversity efforts have really been broadened this year. And in particular, I want to note the appointment of 2 diversity, equity, inclusion associate chairs and 1 as an associate chair for women in medicine. In Stanford Prevention Research, we've seen a program for master's degrees in community health and prevention, drawing in a very diverse group of students. All of our faculty engage in teaching, and this year we're going to highlight some of those particular issues around student guidance and how the student guidance program might enhance clinical skills. We're also pointed out that many of our fields of inquiry are not as diverse as they should be. And so, for example, one of our economists is taking on extra work in mentoring women in the early part of their career in medical economics. We see incredible teamwork going on. For example, work in systemic sclerosis, work in acute myelogenous leukemia, VA patients who have had their medicines optimized by teams of investigators and clinicians. And we've also seen the incredible work that our nephrologists are doing in multiple clinical areas. As always in the report, we like to highlight some of the personal. And so you'll see a great story of one of our couples in gastroenterology. You also see some of the talents that perhaps lurked below the surface. And one of the things we've seen is how one of our cardiology fellows created a recruitment video in addition to her outstanding clinical work. This was a way to put some creativity into a very different type of recruitment season. And finally, throughout the year, our staff, who make so much happen for this department, really showed us how we can work better and smarter sometimes from home. But they've also pointed out that we miss the human element. I hope you enjoy this report. Once again, our communications team has done a phenomenal job of putting it all together. And really what they're putting together is your stories. Enjoy it. Congratulations. And I look forward to when we can share these stories in person.